My name is Jason Toei, and today I'm just going to talk briefly about some of the work I've been doing in my PhD. I'm at Stanford, and I'm looking at how understanding the health impacts of major power outages that occurred in California. So, California is one of the states that are most impacted by major power outages, especially ones that are caused through severe weather events. Over a 20-year experience, they had almost 150 of them. And that's important because many people are at risk when you lose power, especially people that have medical devices that are providing them critical care. So there's been some research looking at what is the relationships between climate events, outages, and health impacts. And it's been very preliminary so far. Mostly that's due to a lot of outage data being private, and then obviously difficulty with health data. And I'm alluding to the difficulty with health data because I have that, but I'm in the process of getting my results approved through. So we will not see those right now. You might see them later, literally in 30 minutes. But yeah, so what basically the studies have found is that we have seen increases in different hospitalizations after major events such as like COPD, other respiratory related events, and especially when it's with an outage plus a climate event as a whole. And these are listed some of the medical devices. So things like ventilators, dialysis machines, and people who might be who have government insurance like Medicaid or Medicare, options also using this. So over here I'm just showing so one of the first years I looked at was 2018, and I'm just showing you some of the different climate events that I pulled from NOAA's storm events database, which maps all different weather events that occurred. And then you also can see the different power outage events over the year. As you see, each month has over 1 million hours on average outages, with November having almost 10 million, and that's due to a major wildfire, which was known as the Camp Wildfire, which destroyed the same areas. So that brings me to kind of what my research as a whole is looking at these climate hazards, how they lead to power outages, and then what's the resulting health impacts. And if you look at the arrows, they go in the different directions of how I'm looking at research. So for both health impacts from severe weather events, but also what's the severe weather impacts on power outages, and then what's the power outages individual impacts on health benefits. So for the work that I've done is I looked between 2017 and 2019. Specifically selecting from major outages. So I use this database called Power Outage US, which collates outage data from across the country. I then selected some of the biggest ones, the first one being First County, because that had, in 2018, it had over 70,000 people lose power. And I then mapped that along with, see if it co-occurred with a relevant climate event. And then using the Medicaid data that I have, track to see how will hospitalizations change in these specific disease categories before and after the outage. So here you can just kind of see kind of my general overview for outage, after outage hospitalization rates. And then these are just a list of the disease conditions, which the only thing to just focus is with respiratory, cardiovascular, and renal diseases. So I can't, like I said, I have results, but I'm not showing them at this exact moment. I see it for a second, but just some considerations and things. Except obviously, it's really important to know kind of what's the dynamics of people when they're experiencing events. So some people might be more less prone to hospitalization based on they have family dynamics around them. Some cities and counties might be more resilient. And there's and understanding the different types of weather events that actually kind of have these impacts. And also understanding different behavior things. So let's say, for example, you might see spiked respiratory infections in some months, but is that related to school-based things or other things? I'll be over there later, happy to chat, and like I said, hopefully get my approval during this next hour. Thanks everyone, yeah.